So today, I am Ken Barron. I'm one of the foundation advisors, along with my trusted co-host and colleague, Mark Hendelson. We come to the AMAC Foundation to assist the advisory group, the Social Security Advisory Group, with your questions, either via email, uh, the questions you send us, or by phone. And we will include that information at the end of our webinar. Today's series of webinars, we are addressing Medicare 2025. Now that we have all the new numbers and we can update a few things moving forward, we want to at least provide you with some updated numbers and maybe as a refresher, some of our Medicare information that we addressed under the Medicare basics maybe a month or two ago during one of our past webinars. And that should be online to be able to take a look at the YouTube video of our website. So again, I am Ken Barron, and my trusted co-host here is Mark Hendelson. Let's get this show rolling. We are going to try to go through this as quickly, briefly, and as efficiently as possible. So some Medicare, very basic information about the parts of Medicare, and this is often misunderstood. Okay, this is all of Medicare. We have the parts A, B, C, and D. What are they? Well, your part A is your basic coverage for inpatient hospital. That's how I've always addressed it. Part A is inpatient. Part B is outpatient services, so such as your doctors, medical tests, and some other things. Now, Part D is an optional part of Medicare because it is a prescription drug coverage, and it does involve a premium. So that's why it remains as an optional coverage. As you can see from the little box below, Part A is free to those who are eligible for Social Security. You can get it as early as age 65. What we are addressing today is just basic retirees, such as a retiree based on their own earnings record, a spouse, a widow, and so forth. This is totally separate from anyone who's on disability. Disability Medicare, especially entitlement or eligibility, is different from a retiree who would be applying for their Medicare at age 65 and not any time sooner, where a disabled individual can get Medicare prior to age 65 and really basically 24 months of being under the disability program, they can qualify for Medicare. Now, there's questions about that. We can address them via email or a phone call to our foundation. The Part B premium for 2025, folks, is going to be $185 a month. That is the basic standard premium. Part D premium varies by a provider and the plan that you select. Now, that is not something Social Security can help you with. It's not anything our foundation advisors can also help you with, but can certainly steer you in the right direction if you so wish. Part C is a Medicare Advantage plan. And we're going to talk a little more about Medicare Advantage plans a little later and basically what it is. So stay tuned. We just wanted you to make sure that it is there. It does exist, and we will get back to you. Now, something super important when we talk about Medicare is the enrollment periods. We have three basic enrollment periods. The fourth one that I have on this slide is an open enrollment period, which is something that had just occurred. And that is for someone who is changing from one healthcare or prescription drug plan to another. But let's start, first of all, with the initial enrollment period. So initial enrollment periods basically is a 7-month window. It includes the month one turns 65. It is 3 months prior and 3 months after. So of turning 65. Okay. So the coverage does become effective the month after someone enrolls. If you're about to turn 65, um, please keep this in mind that you are now probably within your initial enrollment period. If you're within 3 months of turning 65, a special enrollment period occurs when someone, let's say, is still employed and has at age 65 has an employer group health plan, is going to continue working and keeping that employer group health plan. You can opt not to take your Medicare at 65 and wait until a later age. Remember, it's not an obligation for you to file for Medicare at 65 if you are still employed and will continue being employed. Um, and if you have questions about that, if you are being told by your human resource person differently, then reach out to us. We all have experience in this. Mark and I are very experienced, especially in signing up people for Medicare and our work with Social Security in our past lives. Okay. Um, a general enrollment period is for someone who should have applied for Medicare, did not, and now you are over age 65 and you're thinking, you know what? Maybe it should have been a good idea to apply for Medicare at 65, but I didn't. So now I need to. Well, you can only do so during this general enrollment period. And and this happens between January and March of each year, coverage only becomes effective the month after you enroll. Okay. Important thing to remember here, folks, it doesn't say it here, but there could be additional penalties for applying during a general enrollment period because you chose not to before, just by your own choice. You could be paying some additional penalties, and it's usually about 10% more above the base rate, okay, of the 185 Part B coverage. 10% for every 12 months that you should have been covered and you were not. So keep that in mind. It's important. Again, this is all something we can address. Do you need to take Medicare at age 65? Now, I touched upon that real quick a while ago. You do not need to apply for Social Security benefits. Please remember this. You don't need to apply for benefits in order to enroll in Medicare. Social Security has online applications for you to use. You go to Social Security's website. You can apply for retirement, spousal, other types of benefits, including Medicare only. They have a Medicare only application if you're approaching age 65. You've stopped working, okay, and possibly what you're going to do is wait until a later date, although you probably should be applying for Medicare at that point. Okay, you see, there's options. These are things that we go over with you. But you do not need to apply for benefits at age 65 in order to look. I want my Medicare coverage at 65. I don't want checks yet. I want to wait later, maybe till my full retirement age, maybe till age 70. Who knows? Only you know this. These are choices you have. Social Security benefits at and after age 65. If you are receiving benefits prior to age 65, you will be enrolled in Medicare. That's the bottom line, folks. You don't have an option. Once you are receiving Social Security retirement, spousal, widowers benefits before age 65, 2-3 months before you turn 65, guess what? Your Medicare card arrives in the mail. On that Medicare card, it will show Part A and Part B. The reason they send it to you early is that because Part B does cost a monthly premium. Remember, next year that's going to be up to $185. You have a choice of disenrolling at age 65. Again, for whatever reason. You send the card back to where it came from. They give you an envelope for that, and they send you a new card with just Part A on it. Later on down the road, when you want Part B, then you can discuss that with Social Security. Part B isn't mandatory because, again, it does have a premium. If you don't apply when you should, you may have to pay some premium penalties down the road, and you may only be able to enroll. Remember what I said under that general enrollment period? That's when that happens. So be careful of that. I know it's confusing to a lot of people. We go through a lot of training to understand all these A's, B's, C's, and D's, and when to and when not to. Again, questions, we can address that either via email or phone call. Again, we'll put that up on a slide at the end of this presentation. If you do have if you defer enrolling in Medicare because, again, you have an employer group health plan at age 65, you decide you want to wait, as long as you have creditable healthcare coverage, which usually an employer group health plan qualifies for that, you can apply during one of these special enrollment periods down the road after age 65 without any penalty. Okay, that's the important thing now. That's an exclusion from being penalized for more additional 10% penalties above and beyond what your premium is. So keep that in mind. I know we're going to go through a lot of stuff here real quick, but we just need to make sure that you have the information. If you're not sure about it and you may maybe fall under one of these categories, you need to get in touch with us. When should you apply for Medicare? So you haven't signed up for benefits. You're approaching age 65. Okay, remember, you're not collecting. You don't plan on collecting, possibly. Okay, so if someone is not already receiving benefits, you need to contact Social Security and discuss that with them. We always recommend probably about 2, 3, even 4 months ahead of time before you turn 65 to have that discussion. Even if you don't plan on retiring at 65, and by retiring, I mean signing up for Social Security checks, maybe it would be a good idea to sign up for Medicare regardless. Now, some exceptions, okay? If you're full-time employed or and have an employer group health plan, or you're covered under your spouse's employer group health plan as you're approaching age 65, probably don't need Medicare. Part A, Part B. One of the biggest reasons that people report that they really don't want Part B, they don't want Medicare as they approach 65, is that they may be under their own employer group health plan or their spouse's employer group health plan may be contributing to an HSA, to a health savings account. We're going to address that, okay? Bottom line, if you're on Medicare, you cannot continue paying into or contributing towards an HSA. We'll get to that in a bit. So let's say that you're already receiving Social Security as you're approaching age 65. So anyone getting Social Security, railroad retirement benefits, payments prior to 65, you live in our 50 states, DC, Northern Mariana Islands, Guam, any of our territories, SSA automatically enrolls you for Medicare A and B. That's the bottom line, okay? You're going to get enrolled. You're collecting checks. You're going to get a card. It's going to show Part A, hospital, Part B, medical. Here again, the reason for this, if you want both Part A and Part B, you don't need to do anything. You just take your card, put it away in a safe place, all right? When you go to the doctor, you go to the hospital, bring your card. I always recommend do not carry your Medicare card with you. Leave it home. Leave it in a safe place. This way, you lose your wallet, you lose your purse, whatever, your card is safe. Nobody else will have a hand on it. Okay. Because Part B does cost a monthly premium, don't forget that you don't need to actually apply for your coverage. if you are employed. Okay. Um, your Part D prescription, don't need to apply for it. Okay. Unless you do want prescription plan and you don't have it elsewhere and you don't have coverage under an employer group health plan, you would have to apply, of course, for your Medicare coverage in order to have a Part D plan, which is an optional plan because you must pay a premium. So with that in mind, let's move this forward. And I think I'm going to have my co-host here jump on board and talk for a while. I think you've heard enough from me for a little bit. So Mark, you want to take over?
Thank you. Thank you, Ken. So what we're going to talk about next is something that's growing in popularity. We're talking about the Medicare Advantage plans, also known as MA plans. This is Part C. Ken has talked about A, B, and D. This is Part C. Recently, the end of last year, MA plans, more people were on those plans at the end of the enrollment period last year than traditional or original Medicare. They have grown in popularity. They're offered by private companies, approved by CMS, the Centers for Medicare and Medicaid Services, who contributes to these companies and pays them to cover individuals' Medicare benefits. Medicare Advantage plans, MA plans, they bundle coverages, okay? They will include dental and vision and hearing and over-the-counter prescriptions. They offer a lot. They offer a lot. But when you're dealing with a PPO HMO type of plan like an MA plan is, you're going to have some hoops to jump through at times. You're going to have to stick within their networks to have coverage, to have full coverage. You're going to deal with pre-approval for some healthcare services. Premiums often are lower than what you would pay with standard Medicare and a Medigap or a supplement. Okay. There are lots of these plans available. They're set up by an individual's place of residence. You can do research online, put in your zip code. It would tell you the plans and their ratings. So need to do a lot of research. My humble opinion, they're heavily advertised. Lots of promotional materials individuals will get a few months before they turn 65. Don't read any of those materials. Okay, they're selling a product, so they've got a product they're trying to convince you to purchase. I always advise clients that go online, do your research. There are lots of tools online that will compare plans and help you figure out, number one, whether Medicare A, B, and D plus a Medigap or supplemental plan is best for you, or whether an MA Medicare Advantage Part C plan is best for you. Medicare plans are known as Medigap. So if you decide, you know what, an MA plan, PPO HMO type plan, offered through a private company licensed with CMS, that's not the route I want to go. I'm going to stick with traditional or original Medicare. Most people get a supplemental plan on top of their Medicare known as Medigap. It's filling in the gaps on the basic Medicare coverages. Lots of different plan types with different levels, coverage levels, features, premiums. Plan F, zero copay, zero deductibles, no longer available to new enrollees. Not all these plans are available everywhere. Just like with the MA plans, you'll have to do your research to see what is available in your area. The premiums are going to vary depending on your age and the coverage. You can change Medigap coverage from one year to another. Okay. And the plan premiums are on top of your Medicare premium. Medicare premiums, if you're getting a benefit, will be deducted from your checks on a monthly basis. If you're not getting a benefit, if you're just taking Medicare at 65, you'll be billed for Part B and Part D if you're taking that at 65 until you start your coverage. The Medigap premiums, those supplemental type plans, you will pay the insurance company directly. One thing that makes traditional original Medicare and the Medigap plans very popular, they're accepted by all plans that accept original Medicare. So if you have original Medicare, your Medigap plan is going to be accepted. And sticking with the standard Medicare, original Medicare plus the Medigap, 92% of medical professionals in this country will accept your coverage. Unlike the MA or Part C plans, the Medicare Advantage plans, which are limited in territory and providers, when you're with the original and Medigap type coverage, you have a much broader coverage nationwide. Medicare, like all insurance, Medicare doesn't cover anything. It doesn't cover prescription drugs unless you've signed up for Part D, the drug plan. A and B don't cover the prescription drugs, eyeglasses and exams, to get eyeglasses, hearing aids, dental care, long-term care, acupuncture, routine foot care. Keep in mind, some of those coverages are bundled and included if you decide to go with an MA Advantage, Medicare Advantage, PPO, HMO type plan. Medicare will pay 80% of approved covered services, 20% is a copay. Medicare A and B have deductibles, new deductibles in 2025, this coming year. For Part A, the hospital coverage at $1,676. For Part B, the doctor visits $257. And there's no out-of-pocket maximum. Income-related monthly adjusted amount, IRMAA. Really important you understand this provision in the law. As we mentioned, Medicare Part B has a standard premium. Next year it's going up to $185 a month. There is a surcharge that some individuals will have to pay on top of their Medicare Part B premiums. You can see the tiers. They're going to look at your MAGI, which is your modified adjusted gross income, single, and filing. You could see there's different brackets depending on the type of tax return you file. If you're under 106 single filer, under 212 joint filer, there's no IRMAA increase. It's $185 a month starting next year. And then you can see the other tiers, the IRMAA tiers, depending on what your MAGI amounts are, will dictate your Part B premium. So first tier, it's the 185 plus the surcharge, which brings you up to 258.60. And you can see that increases all the way up to $626.70 for those over the $500,000 $1 limit for amount, MAGI amount for single, and then $750,001 for those filing jointly. When Social Security determines whether you have an IRMAA surcharge, they're going to use your tax returns 2 years prior. So for 2025, this coming year, they're going to use your 2023 tax return to make a decision whether IRMAA applies for you. And it's key to understand that this is a new decision that gets made every year. In 2026, they'll use your 2024 tax returns and so on moving forward. So just because IRMAA applies for you or you fall within one certain tier, there's no guarantee the next year you'll have that same tier that will apply. There might be a lower tier or even no tier in the way of a surcharge. Medicare and HSA, Health Savings Account. This is really important for individuals to understand. Okay? The bottom line is you must stop contributing to your HSA when you enroll in any part of Medicare. You may withdraw money from your HSA at any time to pay for qualified medical expenses that Medicare or Medicare supplemental Medigap doesn't cover. Okay. The reason for that is IRS does not allow an individual to have contributions to an HSA if they're enrolled in Medicare. And you need to stop the contributions to your HSA 7 months before you claim your Medicare Part A. The reason for that is when you file for Medicare Part A, if you're 67, it will go back. Medicare enrollment for Part A can be retroactive up to 6 months. So it's really critical that if you're starting your Medicare coverage, A and or B, that you stop contributing to your HSA so there are no tax consequences. Contacting Social Security. You can reach them at their 800 number, which is 1-800-772-1213. Best time to call them. They're open from 8 a.m. to 7 p.m. Monday through Friday, except federal holidays. I find that the best time to get through to them is early in the morning before the West Coast people kick in. Starting January 6th, big change coming with Social Security. You just can't walk in and get service. Social Security is going to change their model, and you must have an appointment. And they're going to do most of these appointments over the phone. Of course, there are exceptions for dire need situations, but Social Security is changing their model and dealing with the public due to multiple requests, regular complaints, I should say, about how long somebody goes and sits in the office. Simply can't do that January 6th, starting January 6th. You'll have to call that 800 number, schedule an appointment. Most of them will be done over the phone, and a representative from your local office will call you back at the time of your appointment. If you need to speak to Ken or myself or another one of the advisors within our AMAC family, you can contact us 1-888-750-2622. You can email us. Ken and I spend a lot of time responding to emails from our members and non-members, our public. You can email us at ssaadvisor@amacfoundation.org. You can get all our contact information at our amacfoundation.org website. Let me close by mentioning that AMAC has a very talented team of Medicare advisors. Okay, so part of the AMAC Senior Resource Network. You can contact our team of Medicare advisors if you have specific additional questions about your insurance needs and your current coverages. You can reach them at 1-800-334-9330. Following this webinar, you will be getting a fact sheet, a recap of what Ken and I shared with you today for you to keep for your records and refer to. Ken and I are going to continue doing these webinars in 2025. If you have any suggested topics, please let us know. If evenings work better for you, let us know that. Our next scheduled webinar is January 13th. We're going to tackle the very important and complex topic of annual earnings test, letting people know how the work rules work when somebody is getting Social Security benefits. So on behalf of AMAC Foundation, AMAC team of advisors, Ken and I want to thank you for attending today. Enjoy your holiday season. And just remember that we here at AMAC, we are here to support your needs moving forward. So reach out anytime in the future uh, for us to assist you as needed. Thank you and happy holidays to all.